Are you taking medications for your fibromyalgia that are not having any real effect? Or maybe one of your medications is actually working, but you're still taking some of the others? You see, when we get prescribed this stuff, we seem to get prescribed everything all at once. You get the painkillers, you might get the duloxetine, you get your analogs, and whatever else they throw at you. And where's the control? You know? Like, let's say, for instance, you're suffering mainly with swelling and stuff like that. Well, then the analogs is the one for you, isn't it? You know, if it's mainly nerve pain, clearly it'll be the duloxetine, which be the drug for you. And if it's just generalised pain, I don't know, maybe painkillers. I don't know. The only real way to find out is to do a bit of a test. And what I've been doing recently, I've been removing some medications, apart from the duloxetine, because I know that helps me already. And also, it's not a good thing to keep on and off that, you see, not duloxetine. You need to stay on it. One of the SSIs, it's basically it's antidepressant. And if you've got fibromyalgia, you should be sort of prescribed quite a small dose, around 30 milligrams a day. And that's all I take, and it really, really helps. Now, I've got a fairly early onset of fibromyalgia. I don't know what triggered it or whatever, but I have. But I have been prescribed other drugs at times, and all sorts of different painkillers. What I tend to do with the painkillers, I tend to swap and change. So I'm not like just constantly on tramadol, which isn't good, is it? You know, it's obviously addiction and all sorts of stuff like that. Some people get mood swings with tramadol. I haven't noticed that. I have to ask the missus. But, you know, it's quite hard really to even know sometimes, because at the end of the day, you know, you can get anxiety and it can cause mood swings. But when I take the duloxetine, I find that curbs that. But sometimes I think you have to go cold turkey. I'm not suggesting that people should give up on the drugs like the duloxetine, that sort of long-term effect. But and some of the other drugs that you might be taking that are being prescribed, you can come off without causing any detrimental actual effect. So be careful of that, maybe take some advice. But what I've been doing is I've been removing some drugs from my daily taking of drugs. I've been removing certain ones and seeing if there's any effect, leaving it a few days and seeing what the effect of that is. And if I feel that there's a marked difference, I think, okay, that helps. So I need to think myself, I'll take that one as get marks out of 10 or something, and then I'll do it with a different drug before reintroducing that one, and see if that has made any. You know, you have to make sure that you give enough time in between. You can't just do one after the other, because the effects of the previous one might not fully worn off. So you need to give you enough time in between. So what I did is I then go on to the next one and then remove that from my intake, and then so forth and so forth. And that way you can kind of work out which ones have, but if you're making sure you're giving yourself good data, which drugs that seem to be having the most positive effect. And if ones that are clearly are not, don't take them. Because, you could be taking drugs on a willy-nilly, with no real scientific backing whatsoever. Because at the end of the day, everyone's fibromyalgia seems to affect them differently, and different medications seem to work better for some people than others. So as the kind of experiment I was doing, and what I've done is managed to limit now my medications. Instead of taking like 6 tablets a day, I'm now taking 2 tablets a day. I'm basically just taking a painkiller. No, sorry, 3 tablets, sorry. A painkiller, Antilox, because I get a lot of joint pain, which might be related to the fibromyalgia. They might actually just be, I don't think it's arthritis. I did have the x-rays and it didn't really show much arthritis at all. I got a start of it, but hardly anything. But that way I've sort of effectively halved the amount of medications I was taking on a daily basis to be the same result as I was before. Well, I was taking all the medications. So 3 of those medications weren't really doing anything for me. Can't remember what they're called though. But anyway, they obviously weren't really doing anything. And I have spoke to the doctor since. She didn't, she thought that's a good idea. But and I've had blood tests and stuff since as well, because I've also got thyroid issues, so I have regular blood tests for that. But I do find it all very complacent if you're just accepting what people are actually prescribing you, and just taking it again and again, and the next one, and the next one, and the next one. With all these bloody drugs on repeat prescription, and if you're paying for prescriptions, well, then obviously it gets expensive. But also, you don't really want to be overdosing yourself with stuff that you don't need. It's about having just enough of what you need, and not actually having too much. Because all these drugs have side effects and long-term damage they can do. Pretty much. Anyway, what say you? And what drugs are you taking? Please leave it in the comments down below, because I do read the comments. I can't always reply, because I do have some other channels as well, but I do actually read all the comments. Toodaloo!